In this 1619 project, Chapter 15, titled Healthcare, written by Janine Interlandi, a staff writer for the New York Times who covers public health, highlights how much healthcare has been impacted by racism and exposes what caused racism to overtake healthcare. None other than slavery. It was a cruel event that shaped the way Americans dealt with different races, especially African Americans. In the U.S., racial disparities in healthcare quality and access still exist today. Approximately 8% of the population, which is 26 million people, do not have access to healthcare. The majority of this group is made up of people of color. While reading the essay Healthcare by Janine Interlandi, we were reminded of the movie John Q, and also the most current issue that involves healthcare is Luigi Mangione allegedly shooting a United Healthcare CEO. These problems illustrate how people struggle to obtain good healthcare, which reveals the racism, biases, and inequalities that are faced.
Janine Interlandi highlights how the U.S. has shown and continues to show profound effort in the systematic exclusion of African and Latin Americans from the human right of accessible healthcare, exposing modern results of slavery evident today. In 2010, a policy to give healthcare coverage to uninsured people was given by President Obama, called the Affordable Care Act, or ACA. The amount of uninsured people was hypocritical because how could the U.S. be such a high-income nation that doesn't offer some form of healthcare to its citizens? This becomes especially hypocritical when the minorities are the ones who have low insurance rates, the ones who have the lowest life expectancy, the ones who have the highest incidence of chronic disease, and the ones who have the highest rates of deaths. These results are the same results seen in the post-emancipation era. African Americans were overlooked and often declined from any source of health care, Interlandi writes. A system was created that provided enough care for freed African Americans to feel okay, but not at their very best, through hospitals established by the Freedmen's Bureau. This mediocrity left Black communities living shorter and sicker lives. However, Black communities did not allow themselves to be dehumanized again as they were in slavery. An organization called the National Medical Association was founded in 1895, which fought and claimed that healthcare was a basic human right. However, there will always be a higher white power that opposes their thoughts, like the American Medical Association, according to page 393. Medicaid and Medicare had been introduced that secured reliable health care for low-income and elderly after the Civil Rights Act of 1964. Racism has been deeply embedded in the U.S. healthcare system from the post-Civil War era to today, leading to health discrepancies for Black Americans and other marginalized groups.
As a diverse group of persons of color, we come to an unfortunately conclusive realization regarding American healthcare. Healthcare as a topic within itself has always been systemically against people of color, from death tolls rising and patients being ignored to disparities in treatment, leaving us underserved by the healthcare industry and overpaying to the government. The disparities of healthcare access and health insurance are so deeply embedded into the culture and history of this country by slavery and racism, which is frightening as growing grows of color. As our current president aims to eliminate healthcare reform, readers of this essay may be filled with a sense of dread that the inequality and disregard will continue. Writer Janine Interlandi uses this collective emotion to advocate for the awareness of the injustices of minorities and holds readers responsible for not advocating as well. Together, we all have a duty to be aware of the injustices around us.